Hey guys, Dr. Nickels here for Dr. Nickels 5 Cents. It's been a little while, and I wanted to talk about melatonin. I do have quite a few patients that come in that are already taking melatonin, and they might have their kids on melatonin. So I kind of want to talk about what is melatonin. So melatonin is actually a hormone that is produced by the pineal gland, which is in the middle of the brain for the most part. And essentially, melatonin production is a circadian hormone, which means that it follows a clock rhythm. But in melatonin's regards, it is like an opposite clock rhythm. So melatonin production is low during the day and it goes up at night. So melatonin production from the pineal gland is all stimulated by light. So people that do shift work, people that might have jet lag, things like that. Melatonin might be something that could be deficient from a production standpoint, but also something that would be used for treatment. Now, we make melatonin. Melatonin production peaks at age 5 and it declines as we get older. So the melatonin production in a 60-year-old is about 80% less than it was when they were 5 years old. So I have patients come in or bring their children in that are on melatonin, and I cringe because one, it's a hormone, and yes, you can get it over the counter, or maybe a pediatrician might have recommended it, but there could be definitely consequences with taking it. So one, if your child is not sleeping, the likelihood of them being melatonin deficient is literally slim to none. When you're giving your child melatonin, it's not really fixing the problem. So what can happen is that might help them fall asleep, stay asleep, but then they're groggy all day, tired, moody, and then, are we having issues in school? Are we having problems focusing? Are we having problems, getting our work done? Because these kids are exhausted because they're not getting restful sleep, okay? A lot of times, too, when parents are putting their kids on melatonin, they're giving them 1 milligram, 3 milligram. I mean, I've seen it up to 10 milligrams. And from a therapeutic standpoint, for jet lag or to reestablish a normal melatonin circadian rhythm for people that work, third shift and stuff like that, you're looking at like 0.5 milligrams to 1 milligram. Some people are giving their kids 10 milligrams. That's insane. Melatonin, because it's a hormone taken at a young age, can actually increase the potential of early menarche, which means getting periods earlier, can throw off just, puberty in general, and is this why we see a lot of, girls getting their periods at, 9, 10, 11 years old? Are they taking melatonin for, 5 years? I don't know. So ultimately, if the child is having sleep issues, like I said, it's not going to be a melatonin deficiency. And so what happens is then these kids, you stop giving them melatonin and their sleep issues come back. And that's because they've never been fixed. So, at the end of the day, we need to focus on what's causing their sleep issue. Now, one, are they going to bed on time? Is it dark enough in their room? When is the last time that they're eating? Are they looking at, playing on their tablets? Are they looking at, their iPhones? Because that specific light of those electronics actually has shown to decrease melatonin production. And so, we see this, increased use in electronics, and we see now, increased incidence of diagnosis of ADD, ADHD. A lot of these kids are on, stimulants during the day, which then creates sleep issues at night. So, if your child is having sleep issues, please, please, please do not put them on melatonin. That is not fixing the problem, and that can create problems long term. There are a multitude of things that could be creating sleep issues in kiddos. Let's give them a chance to succeed, during the day. Let's give them a chance to, do well in school. But a lot of it is going to be dependent on how much sleep that they get. So, we're looking at anywhere from, 8 to 12 hours of sleep depending on age. Kids are not getting that nowadays. The kids are just too busy. Parents are working later, they're eating later, they have homework, and they're not getting the amount of sleep that they should get. So getting into a normal routine will also help with that too. If you do have any questions, if your child is suffering from, insomnia, go to our Facebook page, send me a message, and there's things that we can definitely work out together. But please, please, please do not put your kids on melatonin. And to be honest with you, in 18 years of practice, I think I've used melatonin twice. And I have people that have insomnia issues all the time. So we can definitely take care of the issue, but melatonin deficiency causing sleep issues is rare unless you're older, all right? So this is a very, very, very important 5 cents, okay? If you have any questions, let me know, but we can take care of the sleep issue. But please, no melatonin, all right? Till next time, no melatonin.